I think we were one of the most innovative programs across the state, certainly, and maybe even across the nation at that time. Technology was being used in some of the schools, but because of our service area in serving West Texas, we really had to look at new ways to deliver education, new ways to hire and support faculty. And we did that through the expertise of bringing in a cadre of professionals that could help us develop our programs in technology and building a very robust, well-staffed, well-equipped IT team, which we have, I think, one of the best in the country. Our students have some of the best support that you can get out there being a distant student. And even if you're a full-time student in class, the way technology's changed now, you're still going to be doing things online. Even if you're coming to a classroom and sitting, so much of education is delivered now online.
Telecommuting offers faculty is really flexibility. So you have the full faculty role in this as a telecommuter, meaning that you still have committee obligations. You work on research projects or teaching projects with your colleagues who might be based on a campus.
There was a lot of things that the school wanted to do but didn't have the means to do. I was hired as a web guy, so basically I was in charge of editing the website. But from there it just grew and grew, and we started to add funding for staff. Dr. Green was very instrumental in making sure that the grants, for instance, that people got, and things like that included IT, because a lot of times IT was kind of an afterthought. And at that point, we realized very quickly that information technology was not a nice to have, it was essential.
So what has happened in the healthcare environment, and then if you look at it and then look at healthcare education, is that the government agencies, foundations literally said the magic word, transform. They said to us, change how you teach the students, change how you assess the students. So when they started pushing that, and at the same time saying that whatever you change, how you transform, has to be evidence-based. So take those two pieces together, and simulation was at the same time coming up in since 2002, where we started utilizing simulation, understanding SIM, looking at the evidence base related to SIM. It was like this, it all rose at the same time. It kind of came together. If you look at them and you go back and you want to know what about them, one, they're state of the art. They're one of the best programs in the United States. I can say that because everywhere I go, people ask me about our SIM centers, our program, how we utilize it, what we have available for our students. And when you look at it, they should give you the appearance that you're in a hospital setting, home health, clinic setting, so we can do anything we need to augment them.
We have had an enormous transformation of healthcare using health information technology, particularly our electronic health records, adoption, implementation, and evaluation of those records, and now we really are into optimizing them for clinical workflow. So everything we do at point of care and in transitions of care is being impacted by health information technology. So nursing has been on the forefront. We touch the patient more than any other healthcare professional within the interprofessional team. And as such, we really impact how these electronic health records and point of care technology are used on a day-to-day basis. We impact how they're optimized within the clinical workflow on behalf of the interprofessional team. And it is so important that the entire interprofessional team adopt the electronic health record and this new technology to figure out how to optimize it on behalf of our patients.